Mine don't
Oh
come up
well,
either.
I know. I guess because Joe got this up on the screen. I guess maybe.
Hmm.
Right.
What happened when I pushed the plus at the bottom? I
Uh,
saw several people, so I don't know if that will make it happen because
No,
I
I don't
don't
see
really know
nobody.
where the gallery is.
Oh, that's better. That's better. There I am over there.
okay. Okay. Good. Good. Yeah.
Okay.
Just play around with it a little bit. We'll get there.
Hmm.
One
Okay.
thing I want to mention too is you see your microphone icon on your screen.
At the top.
Yes,
It was for many of you is showing red with a slash going between it, going across it.
my slash is off. You want me to put it on?
Whenever you're not speaking, you want to cut it off
Okay.
and click it so that it's red with the slash going through it. That way we don't get any background noise. Uh, when you get ready to speak, you got to remember to click it again so it cuts back on so we can hear you. So that's when I say mute your microphone, you want to click it so that it turns red. When we say unmute, because we want to hear you, you click it so that it turns back white. Okay. Also, I wanted to mention to everybody about the chat feature. Some of you may have already been shown how to use the chat feature, but if you go to your, there should be a setting on your screen that says more, M-O-R-E, and it has 3 dots on it. If you click that, it'll show you a list of choices. One of those choices says chat. And when you click that chat, you can leave it open. That way you can type in questions or comments right off to the side there in the chat box.
Did you want us to do that now or no?
No, I just want you to know where it is and
Okay.
so you be familiar with how to use it if you want to type something, and make sure where it says to is to everyone. Okay, everybody.
Okay.
And then down underneath for everyone, it says type message here. So you just type in whatever you want to say, and then you hit your enter key, and it'll send that message to all of us so we'll see it. So when we're doing the presentation, if you have a question or you want to be recognized, you can do it through the chat box, and we will recognize you and ask you to turn your mic on for your question. Okay. One other thing I want to show you under your choices down at the bottom of your screen, you see one say reactions. If you click
Bottom.
on, if you click that button that says reactions, you see some icons like a thumbs up, a heart, somebody crying, somebody happy, and
Oh
a
yeah. Mhm.
okay. So if you don't do the chat, you can also click on reactions and do a thumbs up, meaning okay, you like it, or you can click the one that with the hand raised, meaning you have a question. Okay.
Mhm.
All right. Very good. So we still have people joining us, but we're going to keep moving on along for the sake of time. On the screen now, Nikki, you still have us on the screen with the slide.
Yes, I do, Joe.
Okay, on the first slide is just talking a little bit about our group, the Vets Group, our mission. We reach out to veterans, their families, and the community, and we're trying to help them achieve economic empowerment through education, entrepreneurship, and employment. Next slide. We work primarily on IT technology training. So we're trying to get folks employed, back to work, upskill, so they can get into this broad and rapidly expanding IT industry. And we also do other programs in the community and participate like we're doing today, where we're working together to provide this seminar. Next slide. We're located in downtown DC, and at some point in time, when we're all able to come back out and get together, we're going to have all of you over here for a nice celebration. Next slide. And this is the Vets Group. Okay. Now I'm going to present to you our presenter for today, Mickey Nozaki, and she will take it over from here to provide the information for today's seminar. I'm going to turn it over to you, Mickey.
Thank you, Joe. Hi, everybody. Thank you so much for being here today. My presentation this morning, actually morning in California, I'm going to focus on two important topics. Number one, how you can protect your medical identity by knowing all of the fraud schemes that can jeopardize your Medicare benefit. And number two, how you can protect yourself from those things like COVID scams and internet fraud schemes. And all of this information is about knowing what the bad guys are doing and not falling victim to the fraudsters and the abusers, because we all want to live safely and preserve our well-being. Now, during the presentation, I'm going to stop at a couple of points and ask if there are any questions. But in the meantime, like Joe said, if you have any question, you can put it in chat. And then when we stop, Joe can ask all those questions that are in the chat. And at the very end of my presentation, we'll open it up for everybody so that we can all see each other and talk to each other. Okay, so take a look at this graphic. Now, really what I want to say here is that Medicare, the government, spends a lot of money on our healthcare. In fact, if you look at this green section, you see that Medicare spends $800 billion a year providing healthcare for us. And that's great. There's 61 million of them in the country in Medicare. The bad news is the section in the red. You can see that Medicare loses $75 billion of that 800 billion. That's almost 1 in every $10 to fraud, waste, and abuse. That means the criminals are getting our Medicare money when it should be provided to us for healthcare. And as taxpayers, boy, we really should be concerned about all of that. But more importantly than the money, I want to emphasize that healthcare fraud and abuse puts at risk the safety and our welfare. And I'm going to show you a study that was done to prove that fraud and abuse really does affect patient harm. So here you see there was a study that was done by Johns Hopkins University. And it clearly shows that when people go to bad doctors, and bad doctors are doctors who fraudulently bill Medicare. They lie, cheat, and steal, and they put our patient safety at risk. So you see, the study shows that when people go to a bad doctor, somebody who, for example, let's say, uses unskilled people to treat you, or somebody who overprescribes opioids when they shouldn't, or a bad doctor who is practicing with a suspended license, which is not allowed. When people go to those bad doctors, they are up to 22% more likely to die and up to 30% more likely to have such bad care that they have to be rushed to an emergency hospital within 12 months of being treated by that bad doctor. And tragically, the Johns Hopkins researchers also identified almost 7,000 patients who were treated by these bad doctors, these fraudulent doctors, and because of their exposure, they died. So Medicaid fraud and abuse are serious and can lead to dire consequences for us as patients. And now I'm going to show you some real examples of these bad doctors that happened. So you see here on the top is a Dr. Farid Fatah. He used to be a hematologist oncologist from the state of Michigan. And over the course of several years, he gave poisonous chemotherapy drugs to patients who did not have cancer. His abuse caused untold pain and suffering. Many of his former patients who were given the poisonous chemo drugs when they didn't need them are still living with the results of his abusive behavior. And at least 2 cases, his abuse led to the deaths of his patients, all because he was fraudulently billing Medicare, lying, cheating, and stealing money from Medicare, millions and millions of dollars in fraud. Now, the guy on the bottom is a man called Salman Melgen. He was from the state of Florida. He was a retinal specialist, an eye doctor, who overbilled Medicare for almost $70 million for prescribing Lucentis, which is a macular degeneration drug. And he falsely diagnosed many of his older patients. He lied to them. He told them that they had these serious retinal diseases, which they did not. But because he lied to them and told them that they had these diseases, he was able to administer these torturous laser procedures to their eyeballs. And then he billed Medicare falsely for over $70 million. That is where fraud impacts patient harm. In another similar story, I want to talk to you about the CEO of several pain clinics in Michigan and Ohio. Over the course of many years, he recruited patients from homeless shelters, soup kitchens, and normal people walking around who said that they had real pain. But he also recruited people who were drug dealers and people who unfortunately were addicted to opioids. So many of them may have had legitimate pain. Many of these people were addicted to opioids or actually were drug dealers looking for fixes. All of them were perfect victims, subjected to this CEO's company policy. The policy was, if you want your drugs, you have to submit to back injections. Back injections, whether you need them or not. Now, why did he insist that they have back injections? Because that allowed him, the doctor, the CEO, to bill Medicare falsely for very, very expensive procedures. In fact, the back injections were very expensive and they were very, very painful. His patient said that it was almost like torture getting the back injections, and gave these shots to the same people over and over again, just so that he could falsely bill Medicare. To this day, those poor people are walking around with holes in their backs because of all the shots that he gave them. But they all got their share of oxycodone. And he walked away with millions of dollars in Medicare reimbursements. Again, a sad, sad case of fraud. Now, just about any kind of benefit that we legitimately would get as Medicare beneficiaries, those benefits can be compromised and people can steal money from Medicare using home health and hospice billing. So for example, let's say that somebody walks up to you in the supermarket and says, I noticed that you may have a little bit of a limp. Did you know that Medicare has a new program which will provide healthcare services to you in your home, and all you have to do is sign this paperwork? Now you say to yourself, wow, that sounds like a really good deal, right? I would love to have people come into my home and, let's say, do housekeeping for me or take my blood pressure. But these people that are telling you that have you sign that paperwork, that take your Medicare number, those people are going to falsely bill Medicare. And then what happens? You might lose any legitimate home health benefits that you need down the road. So you need to be very, very careful. Don't listen to some stranger who's telling you about Medicare. If you need service, consult with your doctor. The same thing happens with these hospice agencies who are doing things illegally. Now, I think everybody recognizes the term Medicare hospice. Hospice is a real benefit that is provided to people who are actually terminally ill. It provides them with what we call comfort care. So if persons, let's say, are terminally ill and they're expected to pass away in a certain amount of time, they can go on Medicare hospice or Medicaid hospice and be provided with comfort care, keeping them comfortable until they pass away. But unfortunately, what happens is these bad hospice agencies will talk you into signing paperwork, promising that they will give you free groceries, coupons for bus transportation. They'll give you cartons and cartons of Ensure or Glucerna. They might even offer you money to sign paperwork, which enrolls you, signs you up for Medicare hospice. And they will tell you, they will lie to you, and they will tell you, you don't have to be terminally ill. But the problem here is if you're tricked into signing up for hospice, you give up your right to get what we call the curative care, the care that will cure you. For example, we have so many people who were tricked into signing that paperwork, giving up their Medicare information to this strange hospice agency. And then they found out that, oh my gosh, I can't get my needed prescriptions, or I can't see my doctor, or I was supposed to have a heart surgery, but now it has to be canceled because my Medicare record shows I'm on hospice. And I have to tell you guys, once somebody tricks you into signing up for hospice, it takes a long time to clear your Medicare record and get you back where you should be so that you can get your needed medications, so that you can see your doctor, or that you get your needed surgeries. So what I'm trying to tell you here is, please do not listen to somebody who is trying to get you to sign paperwork to get into a hospice or home health program, because it could very well wind up with Medicare denying your services when you need them the most. Serious, and it's all about Medicare and Medicaid fraud. Okay, now I know that mouthful. I'm going to stop right here and see if there are any questions, if I need to clarify anything.
So if anybody has a question, you can unmute your mic and ask your question. Otherwise, we'll continue and then we'll open it up.
I have a question.
Okay, go right ahead.
I'm calling in reference to my mom. So she's in advanced Alzheimer's.
You feel whole again. Such wonderful news, sweetheart. The kids are going to be so thrilled. It's going to be such a nice surprise for them when they come home from
Can you hear me?
see him.
Yes.
So good to see you smile again.
Joe,
Really?
can you, Elizabeth is not on mute and I cannot hear Vic. Vic, I'd like to listen to your question. Go ahead.
I keep unmuting and it goes back to mute.
I can hear you, Vic. Go ahead.
Oh, okay. So my mother, she has advanced Alzheimer's. She's refusing water, food, pills, except every now and then you can kind of force it to her. I was under the impression, I actually just called hospice and they're on their way here at 2 to sign her up. And now you've got me scared because she does have some meds for the Alzheimer's and all that. And I thought she could keep her meds, but you're saying now that they would try to take her off that and just provide comfort meds, I guess.
Okay.
So
Yes, no, yeah, Vic, that's a great question. Let me see if I can clarify that a little bit, okay? If it's a legitimate hospice agency and 2 doctors have certified that your mom is terminally ill, which means that they expect she will pass away within a certain amount of months, usually 6 months or less, they will put her on hospice, meaning that they will give her the medications to keep her comfortable. She's not terminally ill. She should not be on hospice, and no doctor should sign off on that. So really, it's very confusing. I know it's very complex, but I would suggest that you have a question with your mom's doctor to find out exactly what her status is and whether or not she should be on hospice or she should continue with curative care and get skilled nursing at her home.
Okay, thank you. Any other question at this time?
I put a question in the chat. I put a question in the chat.
Yvonne, I can hear you if you would like to ask the question.
Well, my husband was at the VA Medical Center here in DC.
Do I not
And,
get finished? Do I not get finished? It keeps going on mute when I was talking.
We thought you had gotten an answer to your question, Vic. You had another question?
Yeah, it keeps going back to mute. So I am here visiting her in Indiana, and she had pneumonia. She went into the nursing home for 20 days, and she's at home now, and it's really hard to get water and everything into her. So I actually called hospice because I thought it was something that would support her home care. And so I called and begged hospice, we need immediate care. And then I called over to the doctor's office and explained that she's refusing water and this and that, because I was kind of forcing the situation to get hospice. Now it sounds like I should probably step back and hesitate signing her onto hospice, because we would like to prolong her if we can get her liquids and all that to help her, and see how it goes. So hospice is on their way. Should I not sign it? I need to know, because they're on their way here at 2.
No, I wouldn't stop anything at this point, Vic, and I would suggest that we talk about this right after the presentation. I can give you some really good resources where you are so that you can get better information about the local resources. But let's take this conversation off, and we'll talk afterward. Is that okay?
That'd be great. Thank you.
Okay.
Don't
Priscilla, this,
sign anything.
well,
this,
I'll-
this is
I'll
this is Lou.
repeat
I
my
just
question,
need to be,
if I
think you need to be
may.
careful about offering medical advice in this kind of format, not knowing anybody's particular circumstances, and defer to a medical professional for this kind of advice.
Yes,
Yeah,
Lou, I agree, which is why I told Vic that he should talk to her doctor. Absolutely. Yvonne, you have a question?
Well, I was saying that my husband was at the VA Medical Center here. He was a vet. And we were under, I thought undue pressure to put him in the category of hospice care. I wanted him to continue to get curative treatment, but I felt that there was undue pressure to put him in hospice. And he passed, because I think that what they were doing with the morphine and whatever they were giving him supposedly for comfort care was not really addressing the real problem. And I thought that was a bad mark on the VA Medical Center.
Mm.
So,
but
yes.
it was authorized by the doctor to put him in hospice.
Yes, it was. But
Okay.
it was one of the doctors there at the VA Medical Center.
Yvonne, if you believe that there was, let's say, collusion between the doctor and the hospice agency, possibly, and that does happen, then I will give you some information later on in the presentation about reporting suspicious activity, potential fraud. So hold on about that, and then we'll talk about how to report those kind of suspicions, okay?
I have a question.
Go ahead, Loretta.
When you were saying that some of the doctors may not be, or their license has been suspended or whatever, how would you know if the doctor is still performing services? How would you know which doctors are in that field?
Can't you look them up?
Yes, Loretta. In California, we have the Medical Board of California. I'm sure that across the country, every state and district has a medical board that oversees the doctors.
Yeah.
I would contact or go on that website, and you can look up the doctor by name or by license number to see if that doctor is suspended.
Right.
All right, thank you.
Mhm.
Can you hear me? Can you hear
Yes,
me?
Yes, Priscilla, I can hear you.
This is just a Medicare question. I don't know when we have open season for changing Medicare, because I have a number of Medicare medical issues, and they were, people keep calling about, oh, you can get some more coverage and stuff, but I am so leery about looking into other coverages, because what I have, I do like, and I don't pay anything out of pocket. And I go to the doctor a lot for my eyes or my back. So how do I really go about making sure that my coverage is not going to change? And like they be saying, oh, you get more for your money, you get dental and all this other stuff.
Right. Excellent question, Priscilla. And I actually am going to address that, but because you asked that question, I'm going to go to these slides right here.
Okay.
Because you raised an excellent issue. So I'm going to continue on. You guys, if you have other questions, put them in chat or hold on for a little bit, okay? Priscilla raises an excellent question, and we encounter this all the time.
Yes.
Television commercials, newspaper ads,
Yes.
all about insurance agents
Yeah.
trying to sell you a plan that may in fact not be the right plan for you. So for example, we see agents, insurance agents, trying to sell you a Medicare supplement when in fact you have a Medicare Advantage, an HMO, and that's not allowed. We also see people that are insurance agents that don't want to admit that they're an insurance agent. So they say, I'm from Medicare. I'm here to help you. Don't believe them. There are insurance agents somewhere around annual open enrollment. Now, you know that starts in the fall. And they tell you you have to change your plan every year. Well, that's not true. If you have a plan that you like, and you like your doctor and all of your services and medications are covered, you don't have to change at all. Another issue that we see all the time, the misleading television ads saying that we can save you hundreds of dollars, we can give you all kinds of free benefits. The problem is you have to really, really carefully review everything that they're telling you, because they may in fact sign you up for a plan, and then all of a sudden you can't see your doctor because that doctor isn't in the network. Or all of a sudden you find out that you can't get your medications because the plan that they put you in doesn't cover your medications in their formulary. So what I would suggest is that you contact what we call the State Health Insurance Program. Now, this is a program that is in every state and every district, and there is one in DC specifically for you guys. These people are volunteer counselors for the most part, very well trained, very knowledgeable about all things Medicare and Medicaid. And they provide free one-on-one counseling. Now, mostly now, of course, it's over the telephone, but once we get over this pandemic, it'll be in-person counseling again. And I have on the screen here the number that you would call to make an appointment to talk to a counselor. And again, it's free. And they know all the local resources that are available to you, because each plan, each health plan, each company is different from state to state, sometimes county to county. And they are very much unbiased. They can't tell you what to do, but what they can do is they can help you make informed choices about your health care. Okay, so Priscilla, thank you for asking that question. I hope this information helped. And now I'm going to go back a tad. All right. So I will stop again and take questions in a little bit, but I do want to cover this because this is really important. I talked about how you protect yourself and protect your Medicare benefits. So this is what I wanted to stress here. When you enroll in Medicare, you get that little red, white, and blue card, right? And it used to be that that little red, white, and blue card had your Social Security number on it. But because of the Affordable Care Act, Medicare was mandated to remove the Social Security number and put on a random set of letters and numbers that you see here on the screen. See that 1EG4, okay? That is what we now call your Medicare identifier or Medicare number. The information on this little red, white, and blue card, this is key to Medicare fraud, because the criminals, the fraudsters, and the scammers want all of the information on this little red, white, and blue card. And then they take the information and they send claims to Medicare pretending that they have done something for you when they actually have not, but they get the money. So you need to protect that Medicare information. Only share it with trusted doctors, trusted laboratories, trusted medical equipment suppliers. You don't take it out of your wallet and show it to somebody who comes up to you in the shopping center and says, boy, have I got a great deal for you. Okay? All right. Now, when you're on Medicare, you get one of a certain kind of medical statement. And these statements are called Medicare summary notices, or if you have an HMO, you get an explanation of benefits. Now, these things are mailed to you, and they're very similar to a bank statement or a credit card statement. Why do I say that? Because these medical statements show what Medicare says you are getting from doctors and laboratories and equipment suppliers. And the important thing to do with these medical statements is to look very carefully to make sure that only the information on there is what you really truly have gotten. Because if you see something on there that is not accurate, you need to let us know, or let Medicare know. Because if it's on your Medicare record, Medicare believes that that is the truth. Okay, so it's really important to look at those statements. If you see something on that statement and you say, you know what, I don't think I did go to Dr. Smith on April 2nd, call Dr. Smith. Say, hey, I think maybe you guys have made a mistake. Now, if they're adamant and insistent that you saw Dr. Smith on April 2nd and you know you didn't, that could be fraud, and you need to report that. And very, very importantly also, there are so many scammers and fraudsters out there who will call you up, pretend they're representing Medicare, and try to get this information from you. Do not believe them. Medicare will never, ever call you up and ask you for the information on your red, white, and blue card. They already have it. So if you do get a call and somebody's asking you for this private information, do not ever disclose it. Okay? All right. Now, I want to talk about the telephone for a minute, because I think it's really important that we know exactly how the scammers do business. So I thought this graph was really interesting because it shows by age where the scammers target people, okay? So they know that people typically under the age of 70, well, they do all kinds of social media and email and text messaging. So that's where the scammers are going to try to target you. But they also know that over the age of 70, and especially over the age of 80, most people use the phone more for communication than email, text, and social media. So what I'm trying to say here is that the scammers study habits, and they're very, very clever. They know exactly how to reach you and try to victimize you, okay? So one really interesting thing I saw was a suggestion somebody mentioned a long time ago. And what they said was, you know, we get so many telemarketing calls and so many robocalls. And, you know, I pick up the phone and they start talking to me and they're so clever and they know exactly what to say. I heard a suggestion where you take a piece of paper and you write down on that piece of paper something like what I wrote down here at the bottom of the screen. I do not give out personal information in an unsolicited call. And if you have that written down by your telephone, where you don't have to think. Somebody calls you up and starts telling you something. All you have to do is read the little script and then hang up the phone. And if you do know people, and let's say that they might have a mild form of dementia and they get very flustered when somebody calls them up in an unsolicited call. This might be a really good suggestion for them to have by their telephone as well. Now, speaking of the telephone and television, we want to talk about telemarketing fraud. And this is big business. This is a scheme that is going on every day, all day across the country. Let me explain what happens here. Telemarketers, basically scammers, they sit in call centers and they call people, hundreds and hundreds of people every day. And as soon as they get somebody on the phone and they make sure that they're a Medicare beneficiary, they tell them that they're calling from Medicare and that Medicare wants you to have a free back brace. And all you need to do is take out your little red, white, and blue card and read me all of the information on that card. Now, often they also ask for your social security number and your date of birth. And unfortunately, what happens is a lot of people believe that that telemarketer is actually calling from Medicare, and they give up their information. Now, when they do give all their information to the telemarketer says, great, I have all your information. Now I'm going to transfer you to our doctor. And the doctor is going to talk to you for a little bit, write up an order for the equipment that you need, and then send it on so that you can get your back brace or knee brace or shoulder brace or whatever, okay? So the telemarketer transfers you over to a doctor. Now, these people are real doctors, but they're illicit doctors. They're doctors who are doing this only for the money, okay? They're going to talk to you for a few minutes, and they're going to write down what you want. So if you say, I have knee pain or I have back pain, the doctor is going to say, great, I'm going to write you an order for that particular brace. The doctor is going to sign the order and then send the order over to many, many equipment companies, not just one, not just two, many equipment companies, because the telemarketer and the teledoctor now have all of the information that you have given them, your Medicare number, your social security number, your date of birth, everything that is private. And the equipment companies that get these orders are going to start billing Medicare, lying and cheating and telling Medicare that they're actually sending you expensive equipment, charging Medicare thousands of dollars for stuff that you probably will never get. And then, of course, they're making so much money, they're going to pay the telemarketers and they're going to pay the teledoctors. And this is a scheme that happens, like I said, every day, all day, hundreds and hundreds of times a day. So the key here is you don't answer the phone and give somebody all of your information thinking that you're going to get a free back brace. If you need medical equipment, if you need medical services, you go straight to your own doctor. Now, beyond back braces, this scheme also occurs with genetic testing, where somebody might call you up and say that Medicare is offering free DNA testing. They can also call you up and say, you know, we can make a telehealth appointment for you with your doctor. Don't believe them. And the newest scam, and you see this probably on television a lot, continuous glucose monitoring, where television commercials and telemarketers will tell you that you can get this free continuous glucose monitor for free. All you have to do is give up all of your Medicare information. So all of these are scams. You need to talk to your own doctor about medical equipment, telehealth appointments, and if you need glucose monitoring, definitely don't answer the phone and talk to a telemarketer, and do not respond to a television commercial that says we can get you anything you want for free. Okay, all right. Now I'm going to move from the telephone to the computer. This is a slide that I took from the Federal Trade Commission. And if you take a look, online scams, computer scams are just exploding. And unfortunately, what happens is during the pandemic, when we're all hunkered down in our homes, the computer and online shopping has become pretty common, right? Because we can't get out to the store. So we're ordering things online and we're getting our news online. Well, there's a lot of scams going on online, and I want to talk about a few of them. And I put this title up here, Can We Live Safely Online? It's up to us, for a real good reason. Because basically, it's our responsibility to protect ourselves from all of the internet scams and online fraud schemes. Nobody out there is protecting our privacy. It really is up to us. So I want to talk to you about all of the risks out there so that you are much more aware and don't fall victim. Phony websites. Our investigators have told us that they have already reviewed over the past 12 months 96,000 phony websites. Phony websites. Websites that pretend that they're going to sell you, let's say, protective equipment, hand sanitizers, masks. They take your order, they take your credit card information, but they never deliver the goods. Then we see scam websites that actually masquerade as actual company websites, such as Moderna or Pfizer. And these phony websites offer COVID-19 vaccines for sale. That's kind of scary, okay? It is not a good practice to try to get a COVID-19 vaccine from any website, let alone a counterfeit website. But the bad guys are out there doing it and tricking people every day. Because before a lot of people were getting the COVID-19 vaccine, everybody was really scared, right? And even today, there are a lot of people who have not yet gotten the vaccine and are pretty scared about that. So the scammers are taking full advantage. And then I want to talk about the phony vaccine surveys. Now take a look at the flyer on the right-hand side of your screen. This is the real flyer that's going around on email and text messages. And it looks pretty legitimate, doesn't it? Yeah, it's got a big Pfizer on the top and it says, hey, you know, if you agree to take the COVID-19 vaccine survey, you could get at least $90 in rewards. Well, that sounds pretty good. So what do? They lead you to a link down at the bottom that says, here, click here, take the survey now. And all they're trying to do is get all of your personal information. They might even say, once you click on that link, hey, give us your bank account information and we'll automatically deposit your reward in your bank account. Please don't fall for that, okay? There is no legitimate vaccine survey out there. So if you see something like this from Pfizer or Moderna, don't believe it. Just don't fall for it. Another thing to know is that you might get an email or a text message, and it will have an internet link embedded in the message. And, you know, they could pretend that they're sending you something from, let's say, the CVS drugstore or Walmart or Amazon. And they're saying, hey, you better click on this link right away because we have important information for you. Or you get a pretend email from, let's say, UPS or FedEx saying, hey, we have a package that we can't deliver. And unless you click on this link, you're never going to get the package. They're all scams. Don't believe it. If you think that you need to go to a particular website in order to get information, instead of clicking on the link, you get out of that message, you go to your browser and you put in the actual, real, official website address. That's the only way you can protect yourself from all of these scam messages. Okay. One other thing. I want to talk about the privacy of our information. I think you probably know by now that basically nothing is private. Our information is in so many databases, in so many places, in so many states, and so many organizations. It's kind of scary. But the problem is the security and controls around these databases sometimes leave something to be desired. And there are data breaches. So a hacker will get into a healthcare organization's database or a company's database where your information resides. And they will have access to your information, your social security number, maybe your credit card information, whatever that is. So you need to be really, really cautious about protecting your identity. And one of the ways you can do that is by going and getting credit reports from the legitimate credit agencies. Those are Experian, TransUnion, and Equifax, okay? A credit report shows you what's going on with your individual credit. And it's important for you to look at those reports and make sure that everything is accurate and up to date. Okay. Alrighty. Joe, how are we doing on time here?
Well, we're scheduled to wrap it up at 2:15 max. So I didn't know if you want to do any more Q&A and then cover some additional topics.
Okay, well, I'll tell you what, let me just look at this one slide here, and then I think I'm going to open it up for questions. Okay, already. This is a recap, you guys. This is just about basically everything that I already talked about in a nutshell. So it's up to you to protect your medical identity and your privacy and confidentiality. One way to do that, protecting your Medicare and Medicaid information. Okay, so if you have the little red, white, and blue card, and you also have, let's say, an HMO, and you might maybe have Medicare and Medicaid together, all of that information is information that should only be provided when you go to your doctor. okay? Not a stranger on the telephone, not somebody who accosts you in a parking lot. Protect that medical identity. On the right-hand side of your screen, you see a little snippet of a medical statement. These are things that you get in the mail that show what Medicare and Medicaid say you have gotten. Again, just like a banking or credit card statement, you need to look at those statements to make sure that everything is accurate. Because if it isn't, it's on your record, and we need to clarify that and make sure that we get it off of your record. And the way to do that is to report suspicious activity or fraud. Now, I've given you a local number. Now, I'm here in California and I'd love to help you, but it would be best if you contacted your local Senior Medicare Patrol. That is an organization that provides free education and also is available to help you with any questions you might have about your billing. And that number on the screen is the number that you would call for the District of Columbia Senior Medicare Patrol. Again, it's all free, and they're there only to provide information to you and help you with any billing issues, especially if you think something is fraudulent. Okay, and I know this is being recorded, and I am also going to share all of these contact numbers with Joe so he can share everything with you guys. All right, and I'm also going to share this. We don't have time to talk about it. I did put together a bunch of tips on how you can protect yourself, and I will send that to Joe as well. So I'm going to wrap it up here. I'm going to stop sharing so that we can see each other, and you guys, I can open it up now for any questions at all.
Okay.
Yeah, well, this is, okay.
Okay, let's see.
It's
I see a hand raised from Arturo. Arturo?
Yes, yes,
Hi.
yes. How are you?
I'm
boy,
doing okay.
I appreciate this very much. It's a very important information and so forth. I have a concerns to say. I'm not concerned, but ideas that we have. I don't know how you feel about it, but basically, Medicaid is a program that should be for everyone in the country. Basically, that's something that is being pushed now, and it needs to be everywhere. It needs to be the healthcare reform that needs to take place, and that is very important. The other thing is that I am sorry that under this system that we have to, because the system that we have, capitalism produces all these scams and all this fraud and racism and all these things that are going on. So I think it's important to talk about how do we fight this with this thing, but also we have to understand that we're living in a society that is producing all this scam. We are senior citizens, and we have to take this stress to move forward. That's something we need to think about. Okay, I just wanted to say that.
Thank you, Arturo. I appreciate your comments. Okay, Elizabeth, your hand is raised. Elizabeth, you can unmute.
When everyone be calling you about these Medicare or Medicaid programs, so it's best to just hang up on them because you have, just like I already have a representative. So it's best to hang up, right?
Absolutely. That's the best advice I've heard yet. Yes, thank you, Elizabeth. Priscilla, your hand raised?
Yes, I got a question. I keep getting a call from spam risk. What is that?
Say that again, Priscilla. I didn't hear you.
I keep getting a call and it says spam risk.
Okay. You mean before you pick up the phone, it's on your phone, it says spam risk?
Yeah, I won't answer it because I don't know what it is.
Okay, let me explain, Elizabeth. Thank you for that. The telephone companies are required by law to protect you against robocallers. So sometimes the telephone company will know that the call coming into your line is not something that you want. and it will say, this might be a robocall or it might be a spam risk. So actually, you do not pick it up. You're absolutely right. You just ignore that telephone call.
Hello, my name is Janice Mason. My name is not showing up, just a number. But I wanted to ask you, dear, you gave so much great information, ask you about about when people call you from all these different crazy scams and everything. And they said never say yes because they are recording you and they can use that against you. Don't say yes.
That's a good point, Janice. Thank you for that. And yes, the best suggestion, number one, is if you have an LED display on your phone and you don't recognize the number, just don't even pick it up. That's the best suggestion, right? The other thing that we were told by the FBI, if you do answer the telephone anytime it rings, number one, you get put on a list. And that list is for scammers to tell all the other scammers that you actually are picking up the telephone. If you start talking to these scammers, you're put on another list that's sold to scammers. And that list says, hey, this is a person that's actually engaging. It might be a really good target. So the best advice, don't even pick up the phone if you don't know who it is. Thank you for that. Perfect. Sandra, I see your hand is up. You're welcome.
Yes, my question was the number that you gave us for the state health program. They can help you with Medicare and Medicaid, help you with the two, because some people say they don't qualify for Medicaid, but they qualify for Medicare. So I could propose that question to them, right?
Absolutely.
Okay. Thank you.
You're welcome. Joe, are there any questions in chat we haven't talked about yet?
Mickey, this is Lou. Can I just say one quick thing?
Yes.
Captivating presentation, great information. I wanted to point out to our seniors that Cyber Seniors reaches out to many of you to offer training, one-on-one training and other training. And one of the biggest issues that we're encountering is that people don't pick up the phone when they're calling. And it is possible that some of those numbers get intercepted as spam, or the seniors are interpreting them as spam because they don't recognize the phone numbers. So I wanted to just restate to our seniors that if you get a call from an 844 area code number, the chances are almost 100% that that's Cyber Seniors trying to reach out to you to provide you training. So please be aware of that, because we're having a real issue with seniors not picking up calls when they're trying to reach you. Thank you.
Thank you, Lou. Would they be leaving a message?
Yes, they do leave messages. And even today, we dealt with a senior who was complaining that they never received a call. But after researching it, we verified that Cyber Seniors left 3 messages for them. So even leaving messages isn't solving the problem.
Yeah, thank you, Lou, for that. It is important. And unfortunately, that the scammers, the telemarketers, the robocallers have gotten us into a position where we're afraid to pick up the phone anytime at all, which is really unfortunate.
That is true.
Do we have other questions?
Yeah, I know I get at least 5 or 6 spam calls every day. It's from all different areas, different cities, different countries, whatever. It's crazy.
It is.
And that is true, because we are instructed, a member of Washington Senior Wellness Center. We go on several Zooms from different Department on Aging and East River and everything. And we are instructed, if we don't know those numbers, not to answer them. And that's exactly right. What you were saying, Miss Lou, and I appreciate this.
Absolutely. I'm looking at the chat. I wanna see if there's anything there. Cheryl Edwards, Cheryl says, can the patient in sound mind refuse hospice care? Yes, absolutely. And again, legitimate hospice care requires a sign off by 2 doctors, and the family must be involved if family is available. Yvonne, you said, I thought the COVID vaccine was supposed to be free. My EOB showed payment of $35 to Medicare. Okay, now, Yvonne, I would check with the local DC Senior Medicare Patrol on that. You're absolutely right. The shot should be free. The only caveat I have here is that Medicare does allow for providers to charge for what they call an administrative fee, which could be that $35. But what I would do is call the Senior Medicare Patrol, that 202 number I gave you.
Yes,
And
yes. Would you repeat that number? Because I accidentally deleted that number with my cell phone. I put it on my cell phone. Can you repeat that? It's
hold on one. Yeah, let me get that in front of me. Hold on one second.
Thank you.
202 727 8370.
Okay. All
Okay.
righty. Now
And
I
what
went
number is
to
this?
I went to a city agency because I got my vaccine appointment through the DC appointment. So I didn't go to a private doctor, so I was surprised when I saw the payment to Medicare for $35.
Yeah. The best thing to do, talk to the Senior Medicare Patrol and they'll help you. Call the entity, find out what that charge is and whether or not it's allowed by Medicare.
Thank you.
Okay, Joe, we're at the 15 minutes. So, and I don't see any other questions.
Yes, I have one question. My name is Helen Hardy, and I would like to know, is the do not call list still in effect? And also, I would like to know, can my phone that I pay my phone bill to, can they stop a lot of my calls from coming through? I heard that they could, but maybe they just don't want to spend the money.
And Helen, I've never heard of the phone company stopping calls from coming through.
I'm talking about the insufficient calls, the crank calls.
No, the best that they can do is put up a message saying this might be a scam call. That doesn't stop you from picking up the phone and answering.
Okay, what about the do not call list? Is that still in effect?
Do not call registry is in effect. It is a good way of putting your telephone number in the database. The problem is the criminals and the scammers don't pay attention to that.
Okay.
Well, we're going to wrap it up at this point. We will be continuing sessions of this type with Nikki, the Vets Group, and the Seniors Program. We come up again next month, third or fourth Thursday of next month. We will continue presentations of this type at that time. And as most of you know, there are presentations almost every Thursday at this time of different types. But we'll continue along this line. This seemed like a very good topic of discussion today. And I appreciate everyone's participation. Lou August, who is the primary contact person for this program, will be following up. He and his staff will be following up with each of you to provide additional information and to address any additional concerns you may have. So with that, Lou, if you have anything you'd like to say in closing?
Oh, great
What-
job. Captivating presentation, Mickey. And great job putting it together, Joe. Maybe one last question for the attendees. We've been
When is the
having
next class? When is the
It is
next?
it's coming up. But question for you. A lot of seniors still aren't able to use their email, and we're trying to set up a system whereby we send you a link and you could just click that link and get in. Did any of you get in that way? We sent text messages out and we sent a reminder on a calendar to come in. Is that a good idea?
Yes, that's great. That's
Yes,
how
I got
got
into
in.
my email.
Yes, that's wonderful.
Okay, so but we
Both.
still send the registration in advance. So you want us to keep doing the registration too?
Yeah,
Yes.
So we do both.
Yeah.
We'll send registrations, and then as we get closer to the meeting, we'll send you a direct link so you can just click it and get right in.
Oh.
But keep in mind, it won't take you anywhere until 5 minutes before the presentation. So just keep.
Right.
The link is good.
Yeah.
My friend sent it to me.
All right, thanks a lot. That's all I got.
thanks.
Yes,
Janice. How you doing?
Thank
Great
you.
presentation.
Thank
Great
you.
information.
Thank you, Mickey.
Thank you
Everyone
all.
have
Thank you.
a great day.
Outstanding. Very much needed. Very important. Very
Thank you.
informative. Thank you, Ms. Mason. Thank you.
Thank you.
Thank you.
Thank you, Jen.
Yes, thanks.
Joe.
That program.
Thanks to Joe.
Thank you, Joe. Our meeting is over.
Yes. Yes, Janice.
Okay. Thank you,
You
Helen.
all have a good evening.
God
too.
bless. Stay safe.
All right. I will.